Hello, I'm Dr. Teresa Caraway, CEO of Hearing First, and welcome to our Facebook Live Ask Me Anything event. We are here broadcasting from Boston, Massachusetts, where we're attending the American Speech and Hearing Association convention. But this evening I have Dr. Rachel Glade, who is a clinic assistant professor in communication disorders at the University of Arkansas, and I'm thrilled that you're joining us this evening. You and your colleagues came up with this concept of PATH. And so can you, P-A-T-H. So can you talk a little bit about that and what does each letter stand for?
Yeah, so first of all, when we were envisioning this manuscript, we really wanted it to be a quick reference and resource for professionals and for parents. Also, it starts with the early intervention age, but goes all the way through the transition from high school to college or high school to work. Today, we're focusing on early intervention and early childhood, but anyway, so the PATH stands for, the P stands for prepare, A is achieve, T is team up, and H is help.
All right, so let's break those down just a little bit. So when you say P is for prepare, what does that mean?
Yeah, well, for the early intervention age, we're talking about that birth to 3 range, we're really recommending that professionals help prepare families for the journey as a whole. Not just give technology and go, or give technology and make sure they're signed up for intervention, but also think about what supports are in place. Make sure that, is there a concern, if there's a concern for food insecurity or, job or housing, make sure that the appropriate referrals are made so that the family is well taken care of as well.
Yeah, and so if a family is having struggles in an area or feeling like they need some support, they need to discuss that with the professional and let them know that that's an area of need.
Absolutely.
All right, so we said the P, prepare. What about the A, achieve? What does that mean?
Yeah, so for the early intervention group, we're really talking about achieving access to communication. We know that, hearing is about the brain, right? And we need children to get access to communication as quickly as possible, whether, it's the parent's choice for sign language or listening and spoken language. Communication access needs to be established as quickly as possible.
Absolutely, and I think parents need to feel that they are ready and equipped because the language of the home is the language of the heart, and providing rich language experiences is important. And 95% of babies that are born deaf are born to 2 hearing parents. So the terrific news is they're equipped to be their child's first and most important teacher. But we have to act urgently and quickly, don't we?
Yes.
Yeah. All right, so P was prepare, A was achieve, and now we have T, team up. So what does that mean?
Yeah, again, for the early intervention crew, it's critical that families team up with other families that have had this similar experience. They need a good support network. And luckily there's, great organizations like Hearing First that have professional communities for families, or communities for families where they can connect. Also there are other organizations, Hands and Voices, AG Bell, you have state chapters. And I think it's important for families to know if you're not quite ready to meet face-to-face, these online communities are really great options.
Absolutely, and there's many options in terms of the Hearing First family-to-family support community, as well as connecting in online spaces in social platforms such as Facebook or Twitter or Instagram, and those places where parents are exchanging ideas and supporting one another.
Absolutely.
Yeah. Okay, so P was prepare, A was achieve, T was team up, and now we have H for help. Tell us about that.
So when a child is first diagnosed with hearing loss, we know that can just initiate a wide range of emotions for a family. So the H for early intervention really means help get the families connected with appropriate support if needed for that emotional journey of hearing loss.
Yeah, so like we said, it comes to most families out of the blue.
Yes.
And it can be very overwhelming initially. And so providing that support and empowering parents is quite critical.
Yes.
Yeah. And bottom line is they don't have to go it alone, do they?
That's true. Yes.
Yeah.